There's a mic.
So the child is in confined position, and the therapist has tried to correct their shoulder tightness by bringing over the scapular protraction and bring the shoulder in flexion.
That's good. The child is teaching the therapist what to do. I don't understand what he's saying, but it seems like he's teaching her. Okay, good, good. Okay. That's good, right? There's no more space. Okay, can you move back? Okay, some refinements. She was doing the good things that come with the course manual, the table. One thing that I might give as an idea is an IKEA bag over there. I was talking about you've been shopping in IKEA. Okay, so one thing in addition to protecting your back and your body when you're handling is to position yourself where you're not in the way, or that it gives you more flexibility to move from one position to another. It's almost like a dance that you do with the child, because you will be moving as they move, and you have to be in a good position to do it. By doing this, I'm really not doing my back a good favor. By doing this, I limit myself from being able to move him this way or that way. I know we're going that way, but then at the same time, it really limits my ability to reach to the other end of the body, okay? My favorite place is either here or here. And you notice I repeat my positions constantly, and what they're trying to do as part of the belly and rolling and belly crawling is to facilitate what is called as the amphibian reaction. And what is the amphibian reaction? It is the precursor for our mature weight shift and equilibrium reactions. If you are in doubt what the amphibian reaction is, in terms of what it exactly is, think of the little baby and the gymnast. Their position wherein the weight-bearing side is what? What's happening to the weight-bearing side? It's elongated, right? And the non-weight-bearing side is shortened, okay? So, my baby is moving like he's telling me what I was trying to elicit from you. When I said elongation, he elongated his weight-bearing side and shortened his non-weight-bearing side. So, to do that, you would like to be sure that you, just like what I was doing here, you'd have to do a weight shift, obviously, and then facilitate the elongation on that side. With his hands, with his arms kind of trapped there, it's kind of hard for this to lengthen, right? So even if I push this, you would not see as much elongation of this until you free up that hand. And most kids or infants who have or get stuck in movement end up that way. They get stuck with their arms, they don't know what to do with them. So what I might do is weight shift, weight shift, weight shift. Notice that I'm just pushing, weight shift, and then I do a maximal weight shift to free up that hand, and it's freed. That that is the beginning of being able to see how much more elongation there is over there. And then that frees up this hand. I can actually facilitate this to go that way. You could see it, but then what did I do? Did I push like one big swoop? No. What did I do? You can talk, baby. Right, a little tap on the elbow, right? 3 times. That way, and that way. Okay? In that way, I am free with this one. So when I pull over this way, but notice that when I pull him over this way, I'm needing to move my knee away. But where did my other hand go? It went to support this one because I don't want the shoulder to collapse, but I also want to support the elongation of the teres major group. That with sometimes with children with movement disorders or children who don't quite know what to do with their bodies, that gets tight. Okay? So I want to be sure that I have support there and that when I have him weight shift this way, that it's protected. You feel it, right? And so I'll do that, and I do that again, and actually continue to do this, and that happens. And you facilitate the commando crawl even without working with the feet. And I could do the feet later doing the same thing. So what you've done is facilitated the very first component of rolling and belly crawling, which is the amphibian reaction. Translated elongation of the weight-bearing side and shortening of the non-weight-bearing side. Claro? Clear? I thought I was in Florida for a minute. Clear? Howla? No? Okay, good. Thank you. He's here right away. They need your support, members. Hurry up. Baby is ready and willing.
Okay, so this task is about upper extremity weight bearing. So it's about, so the baby will start with a prone lying position. So we will use the arms or the hands as a distal key point while in prone. So we will elicit some neck and trunk movement to lift the head up. And chest off the surface.
Good?
Yeah. So eventually we'll see some contraction of the back muscles. Okay, so we will further facilitate by supporting the chest and maybe some sort of stimuli there to encourage reaching forward. So to encourage weight shift on the other side of the forearm. Yeah. Okay, another thing is about this association of the arms, like for popping of the weight bearing arm inside lying. So it's about a side lying on one side of the arm, and then we will facilitate some sort of reaching for the other side. So to facilitate some trunk rotation and further weight bearing on the other side.
Okay. I'll pick up from where they where they stopped, but take you back a little bit to what we were doing earlier in the other postural behaviors. Because what they were doing is very similar to the previous handling techniques. So I want to move away from that and get into the other thing that needs to happen with upper extremity weight bearing. And so while they facilitated side lying this way, and she went as far as this, I had to correct that one because there was a little bit of locking of the elbows, and I probably would come distal and do some joint compression to get more feedback here and on the shoulder muscles so that then I corrected the locking of the elbows, okay? And because we're dealing with upper extremity weight bearing, I would like to be able to provide the experience for the child to weight bear not only on this side, but also on the other side. So I may facilitate her into a long sitting position. You don't have to go into the long sitting position quickly. Okay? I will facilitate you, trust me. So from there, I would probably do this, and through weight shifting, there. Okay? And so, whoa. Because I was, notice that even my hand went from this to this because of where I was seeing the curvature on her back. And now, with that, I can actually make her do certain things with her hand to reach for things, and then this way again to look for other things. Over here, meanwhile, I want her to this time side sit, and actually I'll make her crawl if I wanted to, right? So, thank you. So it's good to be able to switch from one to the other, okay? So,